step approach. You note down the structural changes, note down each and every volume, loss and superficial lines and wrinkles. That is why I always tell that keep a skull. Explain to them. Okay, हमारा topic of discussion will be today is so in general facial skin is thin, right? We should know in which area it is the thinnest. As we know, blepharoplasty more or less आपका इतने थोड़ा सा lateral कर दिया. This is general idea. Obviously, once you work more.
As a resident who does not have any knowledge about Botox, so this does not happen at the center, it is really insightful, and also knowing the nuances of how to manage a business or a practice after my residency has been really helpful.
I have already been practicing reconstruction and trauma up till now, so I'm planning to switch to aesthetics. I'm starting a center of my own, so this was definitely an insightful experience for me to switch to an aesthetic practice. Altogether a different field, and also how to develop my business, that was also a very good career to develop.
Sir, I'm very thankful to you. Sir, you taught me not only Botox and business ideas, and actually I'm looking forward to more workshops like these with you.
So, being a fresh pass out from plastic surgery, the talk of the business idea, how a young plastic surgeon should excel in his career, that was very helpful, sir, for me.
Recently passed out on August and joined a specialist in the Whitefield Hospital. But this masterclass was a thoughtful process, and how to hold the injection, then how to spread the business. Each and every topic was clearly described by Dr. Anmol sir. I am very thankful for this class.